This is Dr. Kamel again, and medical terminology number 9. If you didn't see any of the previous ones of this series, please go ahead and see them when you have time. So let's start. Subarachnoid hemorrhage. We have the meninges, so this one of them is arachnoid matter or arachnoid layer. So subarachnoid hemorrhage is a trauma. Okay, rupture of aneurysm is another cause. So it could be a trauma, or it could be a rupture of aneurysm. Okay, such as saccular aneurysm or arteriovenous malformation. And what will be the result? Bleeding. That's why we have subarachnoid hemorrhage. Intrabronchial hemorrhage is in systemic hypertension. People who have systemic hypertension most often occurs in bottom of basal ganglia or thalamus, bones, and cerebellum. Amyloid angiopathy is another cause. So systemic hypertension is one. Amyloid angiopathy is another cause. Arteriovenous malformation, again, is a third cause. Vasculitis, neoplasm, or secondary to reperfusion injury in ischemic stroke. So ischemic stroke happened, and then this is called reperfusion, re-establishment of blood supply. And what is the meaning of intrabronchial hemorrhage? Again, this is a bleeding. Okay. Phantom limb pain, most commonly following amputation. Some people who had amputation and still they are complaining about pain in the area of amputation is maybe as a result of reorganization of primary somatosensory cortex. Okay, so there will be sensation of pain in the limb that is no longer present. Okay, and what could be the cause? Reorganization of primary somatosensory cortex. Diffuse axonal injury, maybe traumatic shearing of white matter tracts during rapid acceleration and or deceleration of the brain, like in motor vehicle accident. Okay, so there will be multiple punctate hemorrhages involving white matter tracts lead to neurologic injury, often causing coma or persistent vegetative state, means coma state, like coma state. Conduction aphasia is damage to arcuate fasciculus. We know that the arcuate fasciculus is between the Broca's and Wernicke areas. So the arcuate fasciculus connecting both areas together. Okay, so this is damage to arcuate fasciculus. Global aphasia is damage to both Broca and Wernicke areas, both areas. Okay, heat stroke, inability to body to dissipate heat, and as an exertion, CNS dysfunction like confusion, rhabdomyolysis, acute kidney injury, and DIC and ARDC, okay, disseminated intravascular coagulation. Migraine irritation of cranial nerve 5, the trigeminal nerve, could be one of the causes, or the meninges, or blood vessels, lead to release of vasoactive neuropeptides such as substance B, calcitonin, gene-related peptide. Okay. Parkinson disease, loss of dopaminergic neurons of substantia nigra pars compacta. Like that's why we people who are taking treatment for Parkinson's, they take dopamine in form of tablets. Huntington disease is one of the genetic disease, is a trinucleotide CAG, cytosine, adenine, guanine repeat expansion in Huntington gene, HTT gene on chromosome number 4. There will be toxic gain of function, atrophy of caudate and putamen with ex vacuo ventriculomegaly, like the ventricles inside the brain will be dilated, expanded. There will be increase in dopamine, as a neurotransmitter. That's why there will be involuntary movement and gain of function. Reduced in GABA. GABA is usually causing inhibition and decrease acetylcholine. There will be neuronal death via glutamate excitotoxicity and in MDA receptor binding. Alzheimer disease, widespread cortical atrophy, narrowing of gyri and widening of sulci, okay, senile plaques in gray matter, composed of beta amyloid core, neurofibrillary tangles, composed of intracellular hyperphosphorylated tau protein, reduced acetylcholine in nucleus basalis of minaret. Nucleus basalis of minaret. Okay. Frontotemporal dementia. It's called also big disease. The frontotemporal lobe degeneration, decrease executive function and behavioral inhibition, lead to reduced executive function and behavioral inhibition. Vascular dementia, multiple arterial infarcts, and or chronic ischemia. So ischemia basically to the brain. HIV-associated dementia, secondary or diffuse gray matter and subcortical atrophy in advanced HIV infection. Idiopathic intracranial hypertension, increase in intracranial pressure associated with dural venous sinus stenosis, impaired optic nerve, second cranial nerve, exoplasmic flow, lead to papilledema. Okay. Communicating hydrocephalus, reduced CSF absorption by arachnoid granulation, increase intracranial pressure, lead to papilledema, and also herniation of the brain structures. Okay. Normal pressure hydrocephalus, usually idiopathic. The CSF pressure elevated only episodically. No increase in subarachnoid space volume. Expansion of ventricles distorts the fibers of corona radiata, lead to what is the description for normal pressure hydrocephalus: wobbly, wakey, and wet. Try it. Non-communicating hydrocephalus is a structural blockage of CSF circulation within ventricular system, like stenosis of aqueduct of cervix, colloid cyst blocking, foramen of Monroe, or tumor could be doing that. Okay. Ex vacuo ventriculomegaly, decrease in brain function and neuronal atrophy, appearance of increased CSF on imaging. Multiple sclerosis is one of the autoimmune inflammation and demyelination diseases of the CNS, lead to brain and spinal cord, affecting brain and spinal cord, lead to axonal damage. Okay, and this is that's it for today's one. Thank you. See you in a new one. So.